Ms Aurra from AfriDigital, and welcome to the Frontline Talk, where we're going to be discussing utilizing medical data to reshape Africa's health sector. Today, I'm joined by three incredible thought leaders from the academic and medical fraternity. From Visibility STEM Africa, we have Nataša Lazarević, who is also a PhD student at the University of Sydney in the fields of digital health, machine learning, and anatomy. She's joining us from Australia. We also have Dr. Admore Jokwiro, the founder of MyCPDZW and the district medical officer for Nyanga in the Manicaland Province in Zimbabwe. He is joining us from the US, where he is currently doing his fellowship at Emory University in Atlanta. And joining us from Nigeria is Dr. Uchenna Nwabueze, who unfortunately was called into an emergency procedure at the last minute, but who has kindly made an effort to send in his thoughts, which we will play during the course of this discussion. So allow me to say welcome to our speakers. I hope you guys, I'll say good morning and good evening, because I know you're coming from different spaces of the world. I hope you guys are well and keeping safe during this pandemic.
Thank you. We hope you're, doing well and safe as well, Aurra.
Thank you.
Thank you, Aurra. Good morning and good evening.
Okay, so I'm going to just go over a little bit about our topic for today, which is, as I'd mentioned, utilizing medical data for reshaping and rebuilding Africa's health sector. And a lot of people are asking, what is medical data? What does that mean? So let's simplify it to digital health. I'm a layman. I'm the only layman in this discussion. You guys are the professionals. But I will share my understanding of what digital health is and what medical data is. And that's basically anything to do with your health that can be turned into zeros and ones. So it can be data from your phone. It can be the normal data that you fill in your forms that's translated into a file or a document of some kind online, as well as data captured from your phone. So for example, with iPhone, it will have your little health app, which tracks how many steps you've taken, what your blood pressure is, etc. And that's sort of the long and short of what digital health really is, and how to take all of that and combine it into what's big data. I'm sure we all at this point know what big data is. We broke it down further in the last discussion we had, which was on the data shift. But big data basically is just mass amounts of information collated and curated into qualitative data which you can act upon. So it's the same within the medical space. Now, it's interesting when we look at medical data in the context of Africa's health sector, simply because a lot of people say, well, not everyone has an iPhone. Well, not everyone has an Android app that can collect all the special information. So how do we collect medical data in the context where people maybe don't have the smartest of phones? I was reading an article earlier today which suggested things like where people live, how many people they live with, their marital status. And this is information you can gather from, I think, every form that you've ever had to fill in to maybe even apply for a bank account or anything of that sort. So this all can contribute towards medical data and building a digital health record. So I would like to throw it towards our speakers, because as I said, I'm just a layman, so I'm not the expert here. I would first, oh, I almost forgot to say, I don't know how I forgot to say this. This talk is brought to you in partnership with Visibility STEM Africa. And Nataša happens to be one of the co-founders for Visibility STEM Africa. So Dr. Jokwiro, if you would allow me to let Nataša maybe first give us her understanding of the topic and her position. Nataša, please go for it.
Oh, thank you so much, and thanks for inviting me to be a speaker. I'm super excited about this discussion. And just in terms of digital health, I think there are a lot of opportunities to use digital health in Africa and generally in the world. And what is actually exciting is that the one positive thing about this COVID-19 pandemic is that I feel the post-pandemic world will be more open to the use of digital health and digital records. And as you mentioned, Aurra, there's a lot of information that's already out there that can be used. And if we are able to gather that information and make it electronic, we can use it to basically kind of collate that data and perhaps from that data be able to make predictions or identify key issues. And that's where that data can be used, for instance, to like identify a gap that's existing currently, or it can be used in machine learning modeling. So you get a bunch of data, and then you can just predict the certain outcomes that can occur if you have enough data to train a certain model to be able to see what might happen in the future. But of course, that is all reliant on having people on the ground in Africa who are trained and skilled in, let's say, digital health or machine learning or data acquisition. And if we have enough people who have knowledge of servers to kind of maintain all those systems, as well as, like you were saying, smartphone devices, more of those being deployed on the ground. Access to Wi-Fi is also something that this sort of model will be reliant on. But that's what I guess Visibility STEM Africa tries to do. So what we're trying to do is inspire the future generations to get into STEM, so science, technology, engineering, and mathematics. So to hopefully kind of change that and really impact, I guess, the society on the ground. So people, go to school and are like, wow, this is something I can see for myself in the future. And these kind of opportunities will open up, I guess, more job opportunities for people on the ground. So that's my general thoughts, and I'm very kind of positive and optimistic of the kind of outlook, especially in the post-pandemic world, as on the ground in Africa. So yeah.
Okay, thank you for that. Dr. Jokwiro, would you like to weigh in?
Well, thank you so much, Aurra, and thank you, Nataša, for bringing in that perspective. And I think I want to start from something like the importance of us utilizing our medical data in Africa. I think you all would relate to statements like information is power, the importance of information. When you look at information, I think you said you are a layman, Aurra, but I believe, I think in terms of coming up with definitions, you would probably, not necessarily be a layman on this one, but I would like to say that information is data with meaning. Like when you come up with data and then you come up with a meaning behind that data, then that qualifies as information. And I will try and give an example. Like if you knew that there was a vacancy, like probably at Visibility STEM Africa or at AfriDigital, someone can actually apply if they are qualified for that position. But if they didn't know the vacancy, even though they are qualified, they would never apply for such a job. I mean, that is how important information is. And that is why these are media platforms that provide information have become so powerful and I have many followers, because people want information and people can utilize information for their own good. So you can even make money out of information. So that's the same currents with health. We can be able to improve our health if we know. So with this COVID-19 pandemic, just that has brought to the fore the importance of digital tools. I mean, if you knew that there are no cases in Nyanga, in Manicaland, in Zimbabwe, any person would prefer to go and stay in that area as opposed to staying in an area where there are COVID cases, because we now know the pattern of transmission of COVID-19. But this has been made possible by data with meaning. We now know that if someone contracts COVID-19, they can spread it through that has been made possible by having information available, by studying the cases that got COVID-19, how they recovered. Things like incubation period, like we now know that it takes about 5 days to 14 days for you to be able to show symptoms. This is coming from people studying people that got the cases and then started showing symptoms, and then by following them and following what we call an outcome, you can be able to decide, say that if they don't show some symptoms, then this may not be a case of COVID-19. So I'm just trying to share these examples so that you realize, how important it is for us to collect medical data, how important for us to study it. So when I look at that, and I'm thinking of where I work, which is Nyanga Hospital, I'm thinking of disease control, I'm thinking of prevention, I'm thinking of all the work that we do around ensuring that our community is health. I think information, I think data is right across those areas, and it's right at the center of the work that we do. So if we could harness that information, and if we could process it, which is what Nataša was referring to, and she now is talking of modeling and process, and coming up with predictions. So suppose I collect the data for malaria cases for the last 5 years in Nyanga district, and I bring it into a machine learning model, and I will be able to predict the pattern or behavior of outbreaks. I can know which areas in Nyanga district are most likely to have malaria outbreaks, and at which time of the year. So as a health practitioner who is working in terms of disease control and prevention, I can be able to utilize this to now put in resources in that area in Nyanga district where I know that outbreaks are prone at a certain time of the year, suppose in May, or suppose in March, or in April. Materials to be able to help that community, like give them mosquito nets, like give them mosquito repellents, ensure that the community health workers in that community are actually educating the community that they should stay indoors and not play outside after, suppose, 6 p.m. Things like that. Prevent diseases better. If I gave again my community in Nyanga district gadgets where they can be able to measure their blood sugar and collect that information via maybe a phone, Android or iOS device, I can be able to actually know the burden of disease in my community. I mean, if I can get notifications, suppose someone tests their blood sugar and the result comes up as high, and then I get a notification as a medical practitioner via the device, the application. I can be able to actually estimate the burden of disease in my community, and again, that can allow me to plan interventions that I can use to be able to answer to those needs. So when you look at Africa in terms of need, I think we can be able to actually use medical data to achieve universal health coverage, because that those applications can actually be able to enable us to reach areas where it may be difficult to reach physically. So I think at this point in time, I wanted to really look and discuss and say, hey, the need is there. There are opportunities that we can actually be able to use our medical data to be able to transform our health sector in Africa. So I think for the purposes of the first part of this discussion, this is what I can say.
Yeah.
Very interesting points raised. I'll just quickly summarize what you've both said. Well, the things that really stuck out to me, Nataša, where you spoke about how medical data will assist in coming up with predictions, which then ties into what Dr. Jokwiro says around how sharing information, which is basically what, if we really break down what it is, what it means to have medical data, it's basically sharing information, which will allow us to study patterns, which will allow us to come up with predictions. And then also how, Nataša, I like this point that you raised around how it's important to train, because it's not just enough to understand it. You need to know how to implement it and how to use it. So I'm going to take this moment to, as I mentioned, I had a separate conversation with Dr. Uchenna out in Lagos, Nigeria, and here's what he had to contribute to the discussion.
Well, what I think is the role of medical data in our days, it's basically invaluable, and based on my experience here, I think we do pretty well with medical data and all that, because there's an entire department called Medical Records Department that's distributed almost through all the other departments, clinics, and wards, and all that in the hospital, and they do a good job of keeping records and what have you. But I do feel that digitalization, when it comes to data keeping and medical records and all that, is something that we need to look into. It's something that we need to really work towards, because you find out that still maintaining medical data in would I call it hardware form? it gives room for a lot of discrepancy, because sometimes data could get lost and all that. So having intranets and stuff, within the hospital that helps to collect all the patient's data, information, and everything, and backs it up in a database. That's I think that is what every institution, every medical institution in Africa should need to achieve, because it helps in the long run to back and take a look at certain things that may not have been understood at the time. It may have been going on, but with more light being shed on certain things at the future time, it helps to go back, see, okay, this is a pattern, this happened around this time and all that. So that's basically my thoughts. The place of data keeping and medical records and stuff, it's basically invaluable. So that's it.
If we were to share information across our different health sectors across the different countries, we'd probably be a lot quicker in identifying patterns as well as treatments. Maybe there's a treatment that was given that it's not necessarily part of regulations or what people are looking at, but it worked. Looking at medical data from that angle, what are your thoughts towards that? How do you feel about the fact that some health professionals might be sitting on data gold, but didn't know until this pandemic started to gain popularity? What are your thoughts on that?
Exactly. This was one of the things that caused me to, that made me make that post on Twitter, because I took my time to think about it, after making a lot of observations about patterns of the disease in different countries presently, and at the times when different countries were at the different peaks of the burden of the disease. And then I realized that, considering the symptoms and all that, and considering where I work and the experiences that I've had, I do remember that around that time there were a lot of diagnoses that said, for example, sepsis with chest focus, or maybe atypical pneumonia and all that. And then, because this had not come to light at the time, we didn't consider it as an option. But again, the health, or rather the lack of proper health education among Africans is also a big problem. And not just that, also the lack of proper health insurance and stuff. Because if you would want to carry out a retrospective research on something like this, okay, you would need to maybe probably try to find randomly within different localities people that have had such symptoms within a particular period of time, within a particular period. But then how exactly do you, are you able to say, okay, this person actually had this issue? The only way you can confirm that is if there is a medical record, this person visited the hospital.
Right.
Now, you had your own problem. I don't know if you visited the hospital at the time. I also had my own problem, and I'm a medical doctor. I took care of myself basically, but it was very period in the hospital, like the patient. So there is no record anywhere of me having that problem. But I've really been trying to reach out to a lot of people, trying to see if I could some way lay my hands on some of these COVID-19 antibody test kits that we could carry out randomized. But you realize that most of the people that commented under that tweet, if you tried to take a poll or something, you would find out that about 3/4 of them probably did not present at the hospital for their problems. They
right.
would present as a patent medicine dealer, or just handle their issues at home and all that. And it's all because of the way healthcare is would I say the way it's handled, or poor health education amongst our people, and then lack of health insurance, proper health insurance too. Because if somebody knew that, okay, at any point in time, if I come to the hospital, okay, I'm seeing a doctor at so discounted rate and all that. I mean, the person could, okay, I'm having this problem, it's becoming a problem for me, I'm going to go to the hospital and get it done. And then when you're doing such retrospective research, you're able to pick out, relevant data that you need. So even if I'm going to succeed in doing this, I would have to restrict myself to people with such symptoms at those particular given times that presented at the hospital, because there is no way to know. Because one problem we also have here is the issue of patients coming to hospital and lying about their symptoms, especially with the whole endemic stuff, COVID-19, the way it is right now. They feel like there's a stigma attached to it. So most of them come to the hospital, they want to lie about their symptoms so that you don't send them straight to isolation and all that. So it's a multifactorial problem, and it's something that has to be solved from the top down. That is the truth. So if such a study, okay, go on, please.
No, sorry for cutting off. Please finish.
If such a study is going to be done, then yes, medical data and medical records will have to play a really, really huge role in it.
Interesting perspective offered by Dr. Jokwiro, by Dr. Uchenna. Sorry, I'm looking at Dr. Jokwiro and thinking about Dr. Uchenna. But very interesting points that he has raised, especially coming from the perspective of West Africa. I have a question I would like to pose to both of you, so please feel free to contribute to it. But my question then becomes, we've established what medical data is, what the digital human looks like. Who should be collecting this data? Because I think that's a sensitive point, because to collect this data means that you must sort of have access to someone's personal information. So number one, who should be in that position to collect that data? And number two, how should it be distributed? Whoever would like to take that question first, maybe Nataša?
Yeah, I'll be happy to take that question first. And I think it's a really relevant one, because data collection can be collected in many different ways. And what matters is what Admore mentioned previously. Education and awareness of why this data is important will lead to consent. And if you have people in the communities you want to reach that actually come from those communities, that are engaging with individuals from those communities, it'll make the data collection a lot more easier and relevant to that given community. Because if you just go to someone and it's like, oh yeah, can you sign your consent here so we can access your data and use it in this study that we're doing, you're not providing that person with any sort of information, and you're not being transparent about how that information will be used. And what's the beauty about, I guess, academia versus company structures is, in academia, you require a human ethics application to be processed for you to be able to access certain data. And that can be deployed in hospitals, and a lot of the times in these sort of research settings, there are individuals who work in those hospitals that are part of this research. And especially if, I guess, all the information, patient information, is digitized, it's much more easier to access. But in those cases, so one way you can collect data is directly from the hospital, from patient information. You collect that data, and most of the time you'd have to kind of, I guess, put that data in a digital form to be able to do anything with it. So you might have patient records, or you might survey individuals at the hospital, or deploy surveys in different locations. Or I guess in a company-like structure, a company might create an innovative technology. It can be a startup, and perhaps they create this technology to provide awareness via text message to communities. So that's another form data can be collected. So surveys can be online, and I guess online sort of methods can be, I guess, given to more people and are more widespread in terms of how you can collect them. But again, it's reliant on Wi-Fi connection. So that's one way kind of you can collect data, but it's really reliant on people having an understanding of what that data is, how that data is. And I think the spread of awareness is important, because a lot of the resistance towards digital health is, will my data be safe? Will you be taking my data and then for some reason giving it to other third parties like insurance companies, and you don't even know?
Or big pharma.
Exactly. And people so readily go on Google and search things and use all these random apps and don't have any idea of how much personal information is collected. So it's really important to keep that in mind when we go and then transition into medical data, which is a little bit more sensitive. So that's something we have to keep in mind in terms of data collection. But just going back to your initial question, like, how can this data actually be collected? It can be collected through physical papers, so records of a specific patient. You can design a study and kind of, I guess, survey individuals, and that can be some sort of quantitative data, or it could be qualitative depending on how the survey is designed. You can also have data coming in from different apps, so just tracking, I guess, a person's health over time, and you have that information. And as Admore previously mentioned, you can add a little bit more into it depending on what technology you have. So let's say you design this technology that allows people to measure their blood pressure if they don't have smartwatches. And smartwatches aren't that really good sometimes when it comes to measuring different things like oxygenation levels, for instance, because they don't get as close as they should to little capillaries like in the finger, because they're around your wrist, which is quite interesting. So you can make this technology and then you can get data from that kind of, in that kind of manner. So that's just some few ideas of how you can actually collect data, and I'm sure Admore can add more to that discussion.
Okay.
Thanks, Nataša. So I think just to emphasize what Nataša is saying, so I think agreed, we acknowledge the importance of medical data, that it can allow us to understand, for example, transmission patterns. It can allow us to study a severity of illnesses. It can allow us to plan, come up with modeling and everything else. I think that is key, and that forms the foundations or the basis why we should actually collect medical data. But I think we should also acknowledge that medical data alone, without some other pieces like things like poverty, unemployment rates, etc., can also sometimes be inadequate. So there are also some other data sets that are already out there, like from the World Bank, from UN, that we can also merge with medical data to be able to get more information about why people have certain conditions also, like why we would have typhoid in Harare and not have it in some other place in Africa. I mean, sometimes you have to understand it within the context of the economy of a certain location. I'm sharing this so that we understand, I mean, issues around what your question. I think your question speaks to privacy and security of medical data, Aurra, and that's something that Nataša was addressing, as in the context within which this data is collected is important. So if someone is coming into a hospital, like a clinic, regularly, there's already data which is being collected. Although for most of our institutions, maybe we're still on manual systems, like on paper records, but already we are collecting data. We are collecting medical data, and that is data which is out there. So data can be collected routinely within the hospital setting or within the clinic setting, or when you visit your private practitioners, these medical data that they are already collecting. And it requires the professionals who are collecting this data to keep it, I mean, in confidence, with integrity, and also being available. So there's a triad of confidentiality, integrity, and availability when you are talking of medical data. That we are supposed to be keeping that data in confidence. We are supposed to maintain its integrity, as in we don't alter, I mean, your records, and for the purposes of benefiting maybe insurance, or I mean other issues, and we also need to have this data available when required. So this is this triad, confidentiality, integrity, and availability. It's a kind of a give and take. I mean, if you are maintaining data in confidence, you may then compromise its availability because you want to ensure, I mean, you are limiting the people that you can share it with. If you are maintaining, if you want to make it available, you also then compromise on confidence. This triad, this sort of a gift. So the professionals who are working have to respect the ethics, just like what Nataša said. It's important to know that, I mean, medical information can be shared with anyone. You are supposed to share it with the minimum, I mean, the minimum necessary data. If I want to communicate with my colleague about a case, I'm only supposed to share the minimum necessary for that case. I'm not supposed to overshare, like share everything. Some information may not be necessary and then can be used by someone with a criminal intent behind using that data. Then the recipients are also supposed to process that data with the same ethics and everything else. So that's important. We are supposed to educate the people who are utilizing this information. Like we are supposed to obtain consent from the people that we are collecting the information from. So even if we develop a mobile app and everything else, I think there are some terms and conditions which must be put in place for people to understand how their information will be processed. Then the other important issue is also we are supposed to be able to put safeguards around the transmission and storage of this information.
Okay.
So if you look at the European Union, they've come up with enforcers like the General Data Protection Regulation, GDPR. And this is something I think that is now becoming a standard in terms of worldwide standards when you are looking at enforcement of data protection. So this is something important for Africa to learn from, that we can put in place enforcers, because we cannot stop innovation. We do not want to stop people from innovating and coming up with medical apps, we're coming up with electronic medical records, but what we want to control is how they process the information that they are collecting and security of our people. So if you look at those guidelines, like the General Data Protection Regulation, it is good in the sense that it is quite strict and quite comprehensive, and like you as someone who is processing medical information, you are supposed to get an assessment and an adequate status to say that your policies that you have put in place, your safeguards that you have put in place, be they technical, be they physical, be they administrative, are adequate for you to be able to process medical data. So I think this is how we can be able to enforce privacy and security, by coming up with such physical, administrative, and technical safeguards for people who collect and process medical data. Otherwise, I wouldn't want to restrict people from innovating. I wouldn't want to to restrain companies from coming up with innovations that can help our people. But it is how they process the medical information which we can be able to regulate. And another thing is also the issue of de-identification of medical data. I think that is a standard. That is a standard which is out there, where you can remove some certain identifiers, date of birth, the name, and just leaving the necessary pieces that are required for you. Between question, like if I want to start an outbreak, I may not need certain identifiers like a person's name, like their address, or there are certain cases where you don't need that level of identification. So those are some of the techniques that can be applied to ensure that there is security around our use, collection, acquisition, processing, and dissemination of our medical data.
I just want to add something, if that's all right, Aurra.
Sure.
I thought what you discussed about legislation and the use of de-identified data was so relevant to the current context, because personally, I don't think the legislation is moving fast enough. It's generally quite slow to process these sorts of things, which I totally get, but it's not moving as fast as technology is. And that's something we have to come to terms with. But if there was legislation in place, for instance, to prevent the sharing of data to third or second parties, just like we were discussing, And also, if you think about it, you're using an app, right? You just want to use this app to help you. And you see the screen with all this long terms and conditions about information.
Yeah.
I can tell you, most of the times I don't read that, and I just accept and I provide my consent. And,
Yeah.
you know, between the three of us, we're quite knowledgeable individuals when it comes to this field, and we like to do our own research when it comes to things. But a lot of people who aren't as tech savvy or have understanding of how our data is actually constantly being collected don't even know what security risks they are taking. So if we can even change that screen where you see this long-winded kind of text to something that people will more likely understand, that should be our responsibility as people who are data collecting. So that's something I wanted to add. And also on that note, when it comes to de-identified data, that's the beauty of kind of using machine learning algorithms, let's say within an app. So let's say the three of us are using an app. We each kind of contribute our own personal data, which is linked to ourselves, but protected within, I guess, our user portal. And then we can take data from each of us and collect it and put it in this kind of machine learning pool. And all of that data is de-identified. And of course, some people argue that we can trace, regardless of what data you have, you can trace it back to the individual if you work really hard. But if you have that security in place, it's quite hard to do so. And that's the beauty of machine learning. You de-identify the data, and depending what model you use, you can predict certain things. So I totally agree with what you said, Admore, of even when it comes to scientific studies, if you can kind of conduct a study in a hospital and de-identify data as much as you can and have security measures in place, for instance, only storing that collection file of data in a secure location that has a server that is protected. And I think for all of this to be possible, it requires an integrated approach. So at the political level, at the level of law, at the level of science on the ground, so many different kind of places have to work together to actually, in order for it to be a cohesive system. So yeah, I thought I'd just add that. But yeah, amazing points, Admore.
Great additions from both of you. I love how you have steered the conversation. This is working the way in my mind I thought it would. I want to touch on something that I think we can all relate to, and it's to do with the collection and the dissemination of data. I know we have a lot of medical professionals who are on the ground. We have a lot of nurses who are watching this right now, doctors, people who are actually in the front line fighting COVID every single day. Then we've got social media, which I feel is the biggest disseminator and collector of data, right? I hope that all of you are part of some kind of Facebook group that's to do with COVID-19 updates, or a WhatsApp group, or a Telegram group, but there's some kind of community that you're connected to, which is giving information about COVID-19 in whichever form it comes, whether it's, this is a lot of people sharing pictures of loved ones who have succumbed to the pandemic, others sharing their experiences, pictures of them on the ground in their PPE. So I feel like social media has inadvertently become sort of a huge data bank. And then in that, there's a catch-22 there as well, because there's by sharing the person, perhaps maybe you've lost a loved one and you've shared your relative or your friend who has succumbed to the virus. Is that not also at risk of creating a stigma? I'm not saying it's wrong. I'm just postulating and asking a question, that those who perhaps were in contact with that person can suddenly, panic. Can it induce panic? Is it helpful? How do we utilize that? Because not everyone maybe has access to all the apps required to collect data, but a lot of people have access to basic social media like Facebook groups. How do we create, or how do we utilize those data banks? Can we draw out of those data banks? How can medical personnel on the front line contribute towards medical data collection and curation? I know these are really difficult questions, and maybe, because None of us are presidents here yet. Maybe, there's very little, maybe you don't feel like you can answer this question directly, but I feel like as intellectuals, as people who are on the ground and who work in the space, that we can at least have a conversation around how Facebook groups and WhatsApp groups have become data banks, and how medical personnel on the ground can utilize that or help contribute towards informing and keeping everyone, I guess, safe, but also where's the line drawn in terms of what information you can share on those groups. Anyone care to take that up?
I'm happy to give that a go.
Okay.
I just wanted to say, I think Admore will agree with me. I could see you being president, Aurra. I don't know, something about I could see you being president. It's just, yeah. And I totally connect with what you're saying. So immediately, like, I reacted when you asked those questions, because it's something I think all of us have been going through in our personal lives. You have all these people you haven't talked to in a while, connecting with you, asking you questions, and coming up with all these different theories related to what is happening and how can people actually access the correct amount of information. Because there is a lot out there. We're constantly being exposed to so much information that our brain is not used to processing it. So how do we filter different sorts of things, and how can we take advantage of what is happening? And I think if have you both heard of what happened with Cambridge Analytica and how they used social media data to kind of change the elections that happened in the US?
Okay.
So
yeah.
that's the danger of companies, I guess, sharing the data on these social media platforms to different parties. And it can be in a guise of research, but if you're using this data without the individual's consent, yes, they consented to use Facebook, but not for their data to be used to predict their personalities based on what they follow, based on what they like, and then only expose them to the same sort of belief system. So for instance, if you go on YouTube, and this is how the algorithm is created, and you watch one cat video, you will consistently be like being suggested to watch all these other cat videos. That's just how it works. So it's like, it's a very insular space. So we're only exposed to things that we enjoy and we like. So for instance, people who believe in conspiracy theories, they're only exposed to people who believe in conspiracy theories a lot of the time, because that's what they choose to follow. That's the suggestions that they have available to them. So this is where it becomes really tricky, and it's our responsibility to be able to share the correct information. And this is something I'm quite passionate about, and it goes back to what Admore said about that education side of things. Because the three of us will love to investigate certain things, look at published results, and try to reevaluate our own opinions. But there's a lot of people who go for their source of information on Facebook or WhatsApp. And I'm not saying that's bad. I'm sure there's correct information out there. But if you're only relying on that as a source of information, it can be. And that's where I've seen a lot on social media, where a lot of health professionals have been educating people or trying to about that. And it's that balance between not ensuing panic and making sure that people's mental health is looked after, but also pushing towards alertness and cautiousness when it comes to different measures. And this is what I think actually has occurred recently with the WHO statement on the usage of masks. Because they initially said, nah, masks aren't that important to use. But all the data out there suggests, well, they are quite helpful. And did they make that decision because they realized that there would be a shortage, and it's more important that people on our front line have these masks than people who are staying at home and are maybe going out once in a while? So these are the difficult, I guess, decisions we have to make when we're sharing data. But then again, the WHO decision to do that has compromised their integrity as an information source. So that's where the issue lies, of that balance, that tricky, the slippery slope in between not ensuing panic, but also making sure people are looking after cells. So yeah, that's my initial kind of put into that question. But yeah, Admore, what do you have to add when it comes to that?
Yeah, I think you have touched on the important aspects, and I would probably just want to break down your thoughts further in terms of answering what Aurra said. Firstly, I think we all belong to some kind of identity grouping. Be they, I mean, it's our high school, our home area, our hometown, our village, and everything else. And social media has allowed people to coalesce around those identities. Teenagers, millennials, I mean, soccer fans, and everything else. So I can be in a Manchester United group. At the same time, I'm also in a church group on Facebook and WhatsApp.
Yeah.
So that to and everything, but when we have a common threat like COVID, like a health I mean issue, it cuts across those groupings and everything else. And why I'm saying a threat because we all want to live, nobody wants to die. So that inspires some fear, and when there's inadequate information out there, is to know the truth. And once you know the truth, I mean, you can know how to navigate to surface if need be. So I think social media must, I mean, be recognized from that perspective, that it can be able to make information available. But you have to mark my word information here, because remember when we started, I said data with meaning. All data is relationships. So just like what you said, that if I died, or even a picture of someone who is at work doing an operation, like Dr. Uchenna has been called, I mean, into an operation. If he starts broadcasting images from that operation, yes, we can see that Dr. Uchenna is working, but beyond that picture, he's working on someone, and that someone has a family, maybe they have children, they are married, and everything else. So you want to be able to recognize the responsibility around sharing data, that all data is relationships. It is connected to some other things. So as a medical professional, if I'm going to be posting things out there, I need to be responsible and well aware that whatever I'm posting, it has some kind of relationship. I mean, if I share that Aurra is just left St. Anne's Hospital, someone may start thinking, was she visiting someone, or was she sick? So that's, I mean, how important it is. And so that's how important it is for us to recognize the importance of information that we'll be sharing. But like I said, we all belong, I mean, some form of ideas and groups. So as medical practitioners, the question was WhatsApp groups or Facebook groups, are we there as consumers, or are we there as creators of digital content? So if I post, I mean, a picture with myself wearing a face mask, because you know that all data is relationships, I'm a medical doctor. If I'm wearing that mask incorrectly, I now actually influence. So it is important to know that when I go into social media, I have not removed my hat as a doctor. I have not removed my hat as a nurse. Even though I'm there in a Manchester United group, I'm still a nurse. I'm still a medical practitioner. So if I pass a comment in the Facebook group or in the WhatsApp group, that comment is going to be attached to my identity by the people relate. Interpret it from that perspective, that Dr. Jokwiro has said, drink, I mean, you can drink this so much of this brand, so it's okay because the doctor has said it. So I think that is important for people, for us as that's the responsibility that I would want to say to my colleagues out there when we are sharing and participating, I mean, as a consumer or as a creator of digital content on social media. Our data is related to our profession, and as such, our consumers take it up from that perspective. And then coming to other formal institutions, I will just emphasize what Nataša said, importance of institutions like the Ministry of Health, like our hospitals, like other medical bodies, becoming active creators of digital content to influence and model human behavior in terms of disease prevention. What am I saying? For example, in Zimbabwe, for my hospital, Nyanga, where I work, imagine if we had a Facebook group, imagine if we had a WhatsApp group that is disseminating information around COVID-19. Imagine if the next hospital in the next district, Mutasa, Bonda Hospital, Mutare Provincial, I mean, we are currently, following the updates which are coming from the Ministry of Health. And the Ministry of Health is, a media page, a social page, but probably the 5,000 followers. But imagine if all our 1,600 facilities in Zimbabwe, including the clinics and Facebook pages, the reach that we would have, and they were sharing information. Even the danger of having fake news would be, absorbed within that a load of correct news that is coming out. So it is important, just like what Nataša was saying, that creating algorithms like what Cambridge Analytica did. Whatever they did is not something that we condone, in the sense of the objective that they had. But imagine if we had harnessed that for social good, like we decisively create algorithms which follow people who are coming to our Ministry of Health social media page. We understand through natural language processing the things that they are seeking, the services that they want, the kind of information that they hunger for, and then we create content which specifically feeds into what they require, and then influence their medical seeking behavior, like encouraging them to visit the nearest clinic, washing their hands, maintaining social distancing. We wouldn't even need maybe police to be to be going around the streets to enforce, because the people are educated and they are aware about the need. So it's important for us, for our medical bodies, to actually invest in these technologies which Nataša was talking about. It's really important because you can become proactive. But now if we are just reactive, like going onto the sites to dispel, say, this is fake news, and then again after 4 hours we come, this is fake news. What about us coming up with good news, correct news, and then overloading the social media with that good news, so that we are proactive, and then we don't have to be watching our backs and say this is fake news, don't listen to it. So I think that's my take. I think medical professionals must all bear this responsibility, that we can become a force for good if we all come together. Like in Zimbabwe, there are over 25,000 nurses. So imagine these 25,000 nurses actively in WhatsApp groups, in Facebook groups, and disseminate news about COVID, about controlling the disease behavior. This can become a force. A force for good.
Yeah, and I love that note that you said, using that social media for good and the modeling for good, because I just had an idea. Because if you can track basically the locations of individuals, let's say on Facebook, and you can also track what these individuals have been posting, and if they've been posting content that's not in line with the measures and the regulations in place, if you can track where all of those individuals are from, and let's say the largest proportion of individuals from this place that have been spreading misinformation, maybe we need more measures to educate individuals from that given area. And instead of doing a measure across board of requiring a lot of a workforce, etc., predicting which given areas are having issues with providing and educating their population from the kind of social media data that we can collect. So I really like what you just mentioned there. Such a great idea.
Very great ideas coming from you both. I am truly grateful for you to be sacrificing your time to have this conversation. As I've mentioned, we can only just share our thoughts and hope that it will send a ripple through the world and through the people that view this. So allow me to summarize as we've come towards the end of our discussion. One, being medical data is basically information about your health that is available in electronic form. Two, training is incredibly important at this point in time in terms of understanding what information to collect, how to share it, and also how to curate it so that you can start to predict patterns and start to contribute towards coming up with solutions. And of course, eventually, all we really want in the case of COVID-19 is a vaccination, is a cure. So, and then adding on to that further into the discussion around how social media, I think it's safe to say, has become one of the biggest medical data banks especially given what's called the infodemic of COVID-19, given how much information is available about it online, both good and bad information. So I think it's safe to say we've got WhatsApp and Facebook and every other platform has become probably the biggest data banks, and how there's an opportunity for social media listening, as Nataša has suggested, in order to identify who is sharing what information, what is correct, what is in line with global regulations around sharing information around COVID-19. And also how medical professionals, people who are working in the front line or who have direct access to information. I don't just mean the message you got from your aunt or from your friend who's in Italy. The people who are on the ground, who have direct access, who deal with these cases every day, it is your responsibility to share relevant information and information that is not harmful, and that you have a critical role to play. Not only are you our heroes in terms of being in the front line, but you're our heroes online in how you share and educate those around you. Picking up on what Dr. Jokwiro said, that it doesn't matter which platform you're on, you don't remove your hat of whether you're a nurse or a doctor. So whatever you post at this point in time, everyone is paying attention to what you are saying. And sometimes what might seem irrelevant or like really menial or small, someone will take it as the gospel because you are Dr. So-and-so, or you are nurse so-and-so, because you work in the space, or you work at that hospital. You might even just be like an administrator or the janitor. People are looking at you because you are in that situation, you are in the front line. So I feel like this is a really broad discussion. It definitely needed more than an hour. But the conversation continues online. A special thank you to Nataša from Visibility STEM. Good luck with your PhD studies.
Yes.
And please come out and be, lead the way, lead us. Show us what we need to be doing. You are the next wave of leaders within our generation. And Dr. Jokwiro, thank you so much for your time. And thank you for your valuable insight, especially in context to Zimbabwe, and the work you're doing in Nyanga. We wish you all the best in your fellowship, and please do stay safe out there. And we hope that soon, you'll be able to fly back home. And of course, to Dr. Uchenna, we do sincerely hope that your procedure went well, and that your patient is well and has recovered, and that you continue to stay safe. And a special thank you, especially to Dr. Uchenna, who is directly in the front line and dealing with COVID-19 cases. We wish you the safest possible wishes, and that you may come out this on top, and that you don't succumb, or none of your family members are exposed to the virus. Thank you so much to all of you for joining us. Remember to follow us on @AfriDigitalZW, as well as VSTEM_Africa. This is across all social media networks. Also follow @MyCPDZW. That's on Twitter and Facebook. I think it's MyCPDZW Zimbabwe on Facebook. And I stalk all of you. They're doing very important work in terms of telemedicine in Zimbabwe. Dr. Jokwiro, as a special note, actually he is the founder of the telemedicine network in Zimbabwe, and is a pioneer. Please do read his profile. We've shared everyone's profiles. Would you like to share your personal Twitter handles and where people can find you? Basically, these conversations allow people to interact with you, and to get more information around the work that you're doing. And maybe out of this, we can build a really powerful collective. Please, Dr. Jokwiro, would you like to start with where can people find you online?
Well, I'm virtual on every platform. I'm on Facebook. My name is Admore Jokwiro. On Twitter, the handle is @AdmoreJJ, and I'm on LinkedIn. So I'm also even happy to engage on WhatsApp. For those that will carry forward discussions. So, and then at my CPDZW on Twitter, and also our Facebook page, my CPD ZW Zimbabwe. So I'm happy to to engage on these platforms. I think it's important for us as a country to have honest discussions about where we want to take this, to utilize information to help improve our country.
Nataša?
Yeah, amazing. I just actually had to check what my Twitter handle was.
It's Nataša Lazarević.
I think we need to build an algorithm for her to remember the handles.
Yeah, definitely. Because for mine, depending on what handle I can get, I have different Z's or number of T's in my handle. So I was like, it's Nataša Lazarević with 3 Z's, just so you know. And on LinkedIn, I'm happy to connect. It's just my full name. On Facebook as well, it's Nataša Lazarević, and on Instagram, whatever you prefer. I'm so happy to connect if you have any questions. And I agree with Admore. It's so important to share information. And I just want to say on a final note that if just because you think you can't do it doesn't mean you cannot inspire others and reach up to your goals. Even though we're in a bleak situation, you can inspire others, and if you work hard, you can achieve what you want to. So that's what I'd just say.
Sure.
Words of encouragement and inspiration from Nataša. Thank you so much for tuning in and joining us for this very interesting discussion around medical data and its impact on Africa's health sector. Until next time, remember to follow us and remember to continue the conversation online. We'll be here to chat with you and respond to you as you're watching this video. So we wish you nothing but the best. Stay safe, wash your hands with soap and water, and don't touch your face. Until next time, my name is Aurra from AfriDigital. Cheers.